Yeah, welcome everyone and good afternoon to everyone, to the viewers here. Today we are going to talk about a topic of recurrent pregnancy loss. And to speak on this topic, we have Dr. Sunita Ignani from Banjara Hills. Sunita. To give a brief background about a doctor, she has done her MBBS and MD into obs and gynae, and then she has done her advanced diploma into reproductive medicine from Germany. So she is going to talk about the most a topic which is very sensitive for many people who are trying to conceive. So she's going to give us a introduction and understanding about what should be done, what happens. So we're looking forward to hear from you, ma'am, on this topic of recurrent pregnancy loss, brought to you by Apollo Fertility. Ma'am, it's all yours, and we were patiently listening, going to listen to you.
Thank you. Thank you for the introduction. Yeah. So, hi friends. Here once again we are to talk here about some a very important topic and a very painful for the patient. That is recurrent pregnancy loss. So, first of all, miscarriage is something which is very traumatizing and emotionally very difficult for the patient to go through. And that too, if the patient has to go through this a number of times, say more than 2 or 3 times, if she has miscarriages, that is recurrently she's miscarrying, that is even more painful for the couple. And at this time, first thing I would like to tell the patients is that whenever they are planning to conceive, it is important that before they plan to conceive itself, that they consult the doctor, so that if there is any pre-pregnancy medical issues, either endocrinological or medical problems such as diabetes or hypertension, if they are corrected, the risk of them miscarrying at a later point will be lesser. Also, if there are any lifestyle issues, that also, if they are corrected before they actually plan for pregnancy, that will help them in preventing the miscarriage. Now, coming to the topic itself, there are approximately 1 to 2% of the couples who seem to suffer with recurrent pregnancy loss. That is, they seem to miscarry in the first, before they actually reach the term, within 5 months of pregnancy, they tend to miscarry repeatedly. Now, why does this happen? There can be a number of reasons. And unfortunately, in 50% of these couples, we may not be able to really know what is the reason. In 50% of the couples, we may be able to understand what could be the possible reason. And if we do the corrective measures, there is every chance that these couple can have a healthy life pregnancy. Now, coming to the possible reasons for this recurrent miscarriages, first and foremost would be uh, the endocrinological problems. There are couples with endocrinological problems which can have an impact on their pregnancy. If the woman is having a thyroid problem, either she can be hypothyroid or hyperthyroid, or if she is having hormone levels of high prolactin uh, hormone, that also can have an impact on the pregnancy. Other than that, if she has other medical issues like diabetes, these also can impact on the pregnancy and can result in miscarriages. Now, if the thyroid or the prolactin levels are corrected, these patients can have a healthy pregnancy. Also, if diabetes is controlled, this again can result in a healthy pregnancy. Now, the other cause for recurrent pregnancy loss would be having autoimmune disorders. So, women can have antibodies in their blood which can probably prevent the pregnancy from growing, and they tend to miscarry in the first 2 or 3 months of pregnancy. This can happen in a few women, a small percentage of them can have these antibodies, and this is known as the antiphospholipid antibody syndrome. Now, if the woman has this antiphospholipid antibody syndrome, they can they can become pregnant easily, but then once they reach about 6 to 8 weeks, after the cardiac activity comes in, is seen on the ultrasound, later after about 2 or 3 weeks later they can miscarry, or sometimes they can miscarry in the seventh or eighth month also. So, this antiphospholipid antibody syndrome is one of the reasons for recurrent pregnancy loss. And if these women are treated medically with blood thinners, this can help them in having a healthy pregnancy. Also, some of the women can have medical disorders, that is hereditary medical disorders, such as thrombophilias, which are blood clotting disorders. This also can result in recurrent miscarriages. And this condition can be treated with blood thinners like heparin, which can help in thinning the blood and thereby prevent the miscarriages. Now, other than this, there are certain conditions in the uterus also which can cause recurrent pregnancy loss. Sometimes the woman can have an abnormal shape in the uterus, and this shape can also result in recurrent miscarriages. For example, they can have what is known as septate uterus, or they can have uh, uh, what is known as bicornuate uterus, where there are two small uterine cavities. This defect in shape of the uterus, which is something which is present by birth itself, this also can result in recurrent miscarriages. Now, if the woman happens to have what is known as a small partition in the uterus, that is septate uterus, this can be corrected through surgically, and thereby the woman can have a healthy pregnancy up to 9 months and deliver. So these are some of the conditions which can be corrected medically. Then, other than this, there is what is known as chromosomal problems. That is, the couple can have some chromosomal defect in their genes, and this chromosomally abnormal genetic problem can affect the uh, growing fetus, and this abnormal chromosomes affecting the fetus can result in miscarriage. So this is again, which is not very common. About 5% of the couples can have this chromosomal problems, which is known as uh, reciprocal translocation, or balanced translocations can be there, and this can result in recurrent miscarriages. And this problem can be detected by a blood test known as karyotyping, which will help us in detecting whether the patient has this chromosomal problem. And if the patient happens to have this chromosomal problem, then they have to go for genetic counseling, and they may require an advanced treatment like an IVF with pre-implantation genetic testing to have a healthy pregnancy. So these are some of the various causes which can result in recurrent miscarriages. Then the other very important factor a couple have to consider is if they are having any lifestyle factors, like the woman can be obese. This also can result in miscarriages. And if she is having habits like smoking or alcohol, if she takes alcohol regularly, and that too in quantities which is not good, then that also can have an impact on the pregnancy. Then, other than this, taking caffeine also can impact the pregnancy and cause recurrent miscarriages. So, these are the various lifestyle factors which can have an impact on the pregnancy. And this is not only for the women, even the men, if they are smoking and or taking a lot of alcohol, that also can have an effect on the pregnancy. So, it's important that couple who are planning to conceive, and especially if they have history of more than two miscarriages, it is important that they consult the doctor, correct these medical issues and the lifestyle issues in order to have a healthy outcome. So, whenever they consult the doctor will be doing various blood tests. The blood tests will help us in understanding whether the patient has any endocrinological problem, or if they have any uh, blood disorders like thrombophilias, or if they have any antibodies, or if they have any other nutritional deficiencies. All these will be assessed by the doctor, and depending on what exactly is the problem, the doctor will be able to guide you accordingly and give you the correct medication and treatment, so that you will be able to have a healthy outcome. Other than this, it's also important that it's also important that you understand that there are some couples who all the reports, your blood investigations, your ultrasound, all the reports may be normal. That is, 50% of them will have all the reports are normal, and still they tend to miscarry. Now, in these couples, what are the treatment options? So in these couples, there are various treatment options that they can consider. One is going for what is known as IVF ICSI treatment, that is commonly known as the test tube baby treatment, where uh, their eggs are collected and embryos are formed, and these embryos are then tested for any chromosomal problems, and and to understand if these embryos are chromosomally normal. And only those embryos which are chromosomally normal are then transplanted back into the patient's own uterus so that they can have a healthy pregnancy. So this is one option that can be considered whenever the couple have what is known as unexplained recurrent pregnancy loss. Yeah, as I said, for the unexplained recurrent pregnancy loss, they can consider opting for what is known as pre-implantation genetic testing and IVF ICSI treatment. With this, we can understand whether the embryos are normal or abnormal, and transfer only the normal embryos so that they can have a better outcome. So, if there are any questions regarding recurrent pregnancy loss, you can put in the chat box so that we can answer the questions.
No, ma'am, right now nothing. We can continue.
Okay. So, coming to what lot of couples who have recurrent pregnancy loss, they when they come to the clinic, they are very worried, and they are always like wanting to know what is the cause, what is the reason why we are having these miscarriages. So we need to understand that many times is the first miscarriage. The very common reason for the miscarriage to happen is the chromosomally abnormal fetus. This when there is chromosomally abnormal fetus, what happens is the nature itself will stop the pregnancy and the woman tends to abort. So this happens in the first pregnancy itself. 1 in 8 patients can have miscarriages because of the chromosomally abnormal fetus itself. Now it is when after one miscarriage, many times in the second pregnancy, they can have a healthy outcome. It's not that every time you have a miscarriage, you will have a similar outcome in the next pregnancy. So very rarely women will have repeated miscarriages. But it's important that the couple, if they have one miscarriage, that they need to consult the doctor, speak to the doctor, get the required some basic tests such as checking the hemoglobin, understanding if the sugars are normal, checking your thyroid levels to see if that is normal, also checking the uterus shape if it is normal. So these are some things which can be very basic, simple tests can be done initially to understand if there is anything which can be corrected before they actually plan for the next pregnancy. Of course, as I said before, lifestyle issues can also cause recurrent miscarriages. So, if you are having any of those lifestyle factors, like you're a chronic smoker, or you're taking alcohol, or if there is you're taking a lot of caffeine, or you're having unhealthy lifestyle, you're not exercising at all. So, these are some lifestyle factors which can definitely have an impact on the pregnancy. So it is important that if you're planning to conceive, it's better that you correct this. Now, supposing you have consulted your doctor, they have done the regular basic tests, and they said everything is okay, you can plan for the pregnancy. So you go ahead and plan for the pregnancy. Now, once you conceive, this is I'm talking about a patient who had previously miscarried and again they have come for consultation and then now they have again conceived. So once they conceive, it's important that they don't wait for a long period before they consult the doctor. Once the pregnancy test is positive, like if the woman has a delayed menses, say by 4 or 5 days or a week, do not wait for the second month to get completed. It's important that you consult the doctor within 5 days or a week after delay of menses so that the doctor can guide you properly. So once you visit the doctor, they will do your pregnancy test again. They will, if required, they may do a blood test to understand what is the level of your pregnancy hormone, that is known as the beta HCG, and based on that, after seeing your overall health and checkup, they will probably guide you on what are the other tests that are required, and if there is, they will add you some supportive medication so that that will help you in supporting the pregnancy and will help you in continuing the pregnancy in a healthy way. So once the initial consultation is done, usually the doctor will ask you to come for an ultrasound after 2 weeks, so that to understand if there is a heartbeat or not. That will help us in understanding how the pregnancy is going and how healthy is the pregnancy. So that is one thing. So a lot of times what couples do is they have one miscarriage, then they ignore that and they just go ahead and plan for the next pregnancy without consulting the doctor. And if they happen to conceive, they do not come to the doctor immediately. Rather, they wait for the second or third month to get completed before they consult the doctor. Now, this the opportunity to give medication or treat the patient if there is any disorders will be lost if they do not consult before hand. So if they happen to consult in between the period of the first miscarriage before they plan for the second pregnancy, the doctor will be able to correct if there's any medical issues, and thereby they will help you in preventing a second miscarriage. And also, if you happen to conceive, if you consult immediately after you conceive, then the doctor has a chance or an opportunity to treat you medically and give you supportive medication so that the pregnancy goes on in a healthy way. So this is something the couples need to keep in mind whenever they have one miscarriage. Now, supposing all efforts have been done, you have been investigated medically, uh, you have had your checkups, and still, unfortunately, you have a second miscarriage. Now, after two miscarriages, it is now very crucial for you to consult a specialist, a specialized doctor who is more focused on treating recurrent pregnancy loss. Thereby, they will be able to understand what exactly is going wrong, whether you will require any advanced investigations. Now we have advanced genetic assessment tests, which will help us in understanding whether there is anything else which can be done for the couple in terms of treatment. Also, many times we also look for any immunological problems, which is probably routinely we may not be doing for all couples, but whenever they have more than two or three miscarriages, we will probably will want to understand if there is any immunological problems which can have an impact on the pregnancy in future. So immunological disorders is also one of the reason why a woman may not carry the pregnancy to term. And if the immunological disorder is corrected by giving treatment with immunoglobulins, that will help in the woman continuing the pregnancy. So this is something which is not routinely done for all patients, but yeah, when you have more than two or three miscarriages, this is something the doctors would investigate and treat. Now, there are certain couples who, even after giving all efforts, giving all treatments, in spite of all the efforts, they still seem to miscarry. Now, this is very rare, but then, yeah, there are some couples like that. Now, in these patients, we can go forward with some advanced treatments. Now, what do you mean by advanced treatments? There is something known as the pre-implantation genetic testing or screening of the embryos. Now, a lot of couples will, when they come for consultation, when they have more than three miscarriages, they come to us and ask us, Madam, is it going to really help us? Is this treatment will help us in having a healthy pregnancy? Now, as fertility specialists, we cannot tell you for sure that this will really for sure going to give you a healthy pregnancy. But this is one method, one scientific method where we can understand what is the problem in the embryos. Are the embryos abnormal, or do we have a normal euploid, normal chromosomally normal embryos or not? Now, supposing we do the IVF procedure and we get about, say, four or five embryos in hand. These embryos are then tested for chromosomally tested for whether they are abnormal or normal by what is known as the pre-implantation genetic testing. With this genetic testing, a report will come to us, and we will get a report from the genetic lab saying these are your four embryos, and out of these four embryos, only one embryo is genetically normal. The rest of the other embryos are genetically abnormal. So once we get this report and say, okay, only one embryo is genetically normal, only that embryo we can go ahead and put in the patient's uterus. And with this sort of treatment, we can expect a result of 30 to 40% of the women having a healthy, good term pregnancy with this sort of treatment. So this is one scientific method of going ahead whenever you have recurrent pregnancy loss. Of course, when all treatments fail, then using of donor gametes, either donor egg or a donor sperm, is the last option, which is considered in women whose all the medical treatments fail to result in a healthy pregnancy. So, uh, if there are any questions, I can answer the questions. So, yeah, there's one question in the chat box which is saying, how much gap would you suggest after second pregnancy loss, before starting the next treatment? So, it is not the question of how much gap we need to have before planning for the next pregnancy. Whenever you have two pregnancy losses, it's important that you consult the doctor, have a detailed discussion, make sure that all the tests are done before actually planning for the pregnancy. Because if without proper investigations and properly analyzing the reason for the pregnancy loss, if you start planning for the pregnancy before that, there can be a high chance that you can again have a miscarriage. So it's important that first the investigation has to be done properly. It may take sometimes 2 or 3 months, and once the investigations are thoroughly done, then only plan for the pregnancy. Of course, as a general figure, I would say around 3 to 4 months is the minimum gap you should have before you plan for the next pregnancy. So, what is spot? So, there's one question in the chat box which is asking like, what is spotting during pregnancy, and does it mean pregnancy loss? So, spotting in pregnancy is something which we see in many of the patients, even if they have a healthy pregnancy. So, the spotting can be because of number of reasons. It could be implantation bleed. So, once the pregnancy is positive, when the embryo is getting implanted, there can be sometimes bleeding, and this can appear like a spotting. So this sort of bleed is something which is seen even in a good healthy pregnancy. So not all pregnancies with spotting means that it is going to have a bad outcome. Lot of times it is just an implantation bleed, and the patient can have a good healthy pregnancy. So there's one question which they are asking: when do we start blood thinners? So, blood thinners are something which is not given as a routine to all patients, but these are given in a specific group of patients who are having hereditary thrombophilia or antiphospholipid antibody syndrome patients. These are the patients who are recommended for blood thinners. Now, these are given once the fetal heart is visualized on ultrasound. That is approximately around 6 weeks of pregnancy, and it's important that the doctor uh, gives the prescription rather than the patient taking the medication on their own. So there's one question in the chat box where they're asking what is torch IgG positive, IgM positive, IgM negative. Okay. So torch test is something which is has been available since many years, but as per the recent guidelines, torch test is something which is not recommended as a test for recurrent pregnancy loss. So we no longer do torch test for recurrent pregnancy loss. Yeah, there's one more question in the chat box. Does stress lead to recurrent pregnancy loss, and will bed rest during treatment help? So, there's no studies to say that stress has an impact on miscarriages. But then, yes, whenever you are pregnant and if you have previous history of miscarriages, it's important that if you are stressed about the pregnancy, it's important that you go for a psychological counseling, do meditation and yoga, so that your stress levels are decreased. That will help in uh, going through the whole pregnancy in a better way. But itself is not a cause for miscarriages. Also, bed rest is something which will not, as a routine, not recommended for patients with recurrent miscarriage. But precautions are important. Precautions in the sense avoiding journeys, long journeys, or avoiding excessive exercise which they are not accustomed to is something which should be taken care. But bed rest is not something mandatory if you have recurrent pregnancy loss. But studies have shown that just uh, caring for a patient with recurrent pregnancy loss, tender loving care, what we say, is very important, and that itself will help in having a positive outcome for these patients.
Ma'am, there is a question which says that she wants to know that they heard a sperm problem related to a DNA damage. Can it result in recurrent early pregnancy loss? Is it true?
Yeah. So, yeah, I did not mention about the male factor. Yes, the male factor, that is the uh, sperm DNA fragmentation test, is something which we do recommend for patients with recurrent pregnancy loss. So even the male semen parameters can be normal, but still they can have what is known as high sperm DNA fragmentation. What do you mean by high sperm DNA fragmentation? Here, the sperm physically, when you look at under the microscope, they may look normal, but the DNA material inside the sperm can be damaged, and this damaged sperm DNA material can have an impact on the growing fetus, and that can result in a miscarriage. So, whenever an abnormal or damaged sperm is resulting in a pregnancy, that can miscarry. So, men with high sperm DNA fragmentation levels can cause recurrent pregnancy loss. So, as a part of the workup for patients with recurrent pregnancy loss, we also do what is known as the sperm DNA fragmentation test for the men to understand if they are having high sperm DNA fragmentation. And in case they happen to have high sperm DNA fragmentation, then they are given medication in order to so that the sperm DNA fragmentation levels decrease, and they can have a good outcome in the next pregnancy. Yeah, thank you, viewers. We had a wonderful session on recurrent pregnancy loss, and we hope to see you again in the next session for one more topic related to reproductive medicine. And we welcome you all with any queries or any questions. You can always log into our website uh, and reach us through our email. Thank you.
Thank you, ma'am. Thank you so much.
Yeah. Yeah. Okay. Yeah.